Okay, folks, now I've got discussion B for you. We're discussing health crisis. And 3 and 4 American adults now have chronic conditions. Okay, I'm going to explain that to you now. It is a stark reflection of a growing public health emergency in the U.S. The surrounding page content emphasizes that nearly 200 million Americans are living with long term health issues, including common conditions like high blood pressure and diabetes. The key context from the page the statistic the, stati- the stat, statistic refers to prevalence refers to the prevalence of chronic diseases, which are defined as conditions lasting at least 1 year, requiring ongoing medical attention, and potentially limiting daily activities. Okay, now I'm going to go through these for you. Chronic conditions now affect 3 out of every 4 adults, with the burden increasing across all age groups, from young adults to seniors. This surge is linked to lifestyle factors like poor nutrition and inactivity, social social detriments such as economic instability and limited healthcare access, and systematic issues like healthcare worker burnout and insurance gaps. Why it matters. Chronic diseases account for 90% of U.S. healthcare spending, driving up costs and straining medical systems. The rise in multiple chronic conditions, MCC, were where individuals suffer from 2 or more illnesses, is particularly concerning, as it leads to higher hospitalization rates, medication use, and long term care needs. The CDC and other health bodies are sounding the alarm through initiatives like Vital Signs, urging earlier interventions, tailored preventions, strategies, and systematic reforms. If you're exploring how to translate this crisis into actionable frameworks, especially for marginalized or aging populations, I'd be glad to help you map that out. Okay, culturally responsive strategies or co-design kits. Chronic conditions, also called chronic illnesses, are or diseases, are long-term health issues that typically last a year or more, require ongoing medical attention, may limit daily activities or quality of life. Here's a breakdown of common chronic conditions across physical, mental, and systematic domains: cardiovascular and metabolic, okay, high blood pressure, hypertension, Heart disease, e.g., coronary artery disease, heart failure, diabetes type 1 and type 2, and gestational also. Okay, high cholesterol, obesity, often a risk factor and condition itself. Okay, neurological and mental health, Alzheimer's disease and other dementias, Parkinson's disease, depression, bipolar disorder, schizophrenia, anxiety disorders, respiratory, asthma, chronic obstructive pulmonary disease, includes COPD, emphysema, and chronic bronchitis, cystic fibrosis, musculoskeletal arthritis, includes osteoarthritis and rheumatoid arthritis, osteoporosis, Ehlers-Danlos syndrome, autoimmune systematic lupus, multiple sclerosis, Crohn's disease, ulcerative colitis, dermatological and other eczema, psoriatic psoriatic arthritis, chronic kidney disease, chronic liver disease. These conditions often intersect, especially in older adults, creating complex care needs. For example, someone with diabetes may also have hypertension and depression, requiring coordinated, culturally responsive interventions. If you're mapping chronic condition clusters for aging populations or designing toolkits for caregivers, I can help you build out condition-specific modules or adaptation matrix. Want to explore that next? Chronic conditions can shape nearly every aspect of daily life, physically, emotionally, socially, and financially. Here's a structured breakdown of how they affect individuals specifically, especially older adults and marginalized communities. Physical functioning independence. Activities of daily living, like bathing, dressing, cooking, and mobility, may become difficult. Fatigue, pain, or limited range of motion can reduce stamina and increase resilience on caregiver or reliance on caregivers or assistive devices. Conditions like arthritis or COPD often lead to reduced mobility, making even short walks or stairs a challenge. Mental health, mental and emotional health. Loss of independence can trigger depression, anxiety, or grief over diminished capacities or capabilities. Social isolation, especially in rural or underserved areas, can worsen mental health outcomes. Cognitive conditions like dementia affect memory, decision making, and communication, straining relationships and routines. Healthcare burden and routine disruption. Frequent doctor visits, lab tests, and medication schedules can become part of daily life. Managing multiple conditions, e.g., e.g., diabetes, hypertension requires complex care coordination and self monitoring. Individuals may need to track blood sugar, blood pressure, or symptoms daily, daily, often with digital tools or caregiver support. Financial stress. Chronic illness often leads to increased out of pocket costs for medications, transportation, and home modifications. Missed work or early retirement due to disability can reduce income and strain family resources. Social relational impact. Reduced energy or mobility can limit participation in social events, hobbies, or community life. Caregivers' relationships may shift from mutual support to dependency, affecting family dynamics and emotional well being. Cultural and structural considerations. In marginalized communities, chronic conditions are often compounded by limited access to culturally responsive care, transportation, or healthy food. Uh, Language barriers, stigma, and mistrust of medical systems can further isolate individuals and delay treatment. If you if you're designing interventions or toolkits, we could co-create models that address these domains like ADL support guides, mental health check-ins, or culturally adaptive care plans. Want to sketch out a framework for that? The emotional toll of chronic conditions is often underestimated, yet it's deeply intertwined with how individuals experience illness, identity, and daily life. Here's a deeper dive into the emotional landscape. Initial initial emotional shock. Diagnosis often triggers a cascade of emotions: fear, disbelief, anger, sadness, and even shame. Many feel a loss of control or betrayal by their own bodies, especially when symptoms disrupt previously normal routines. Ongoing, ongoing psychological strain. Depression and Depression and anxiety are common, particularly when symptoms persist or worsen. Individuals may feel guilt or embarrassment about needing help, missing work, or not bouncing back. The uncertainty of prognosis, not knowing how the condition will evolve, can lead to chronic stress and emotional exhaustion. Identity and self perception. Chronic illness can reshape how people see themselves, from independent to dependent, from active to limited. Some experience a loss of identity, especially if their condition affects roles they value, e.g., caregiver, worker, community leader. Relational and social impact. Emotional withdrawal may occur due to stigma, fatigue, or fear of being a burden. Relationships can shift. Partners may become caregivers. Friends may drift away, and social circles may shrink. Coping and resilience. Emotional resilience built through support networks, therapy, mindfulness, and self compassion. Accepting a new normal often involves grieving losses, adapting routines, and finding meaning in new roles or perspectives. If you're designing interventions or toolkits, we could co create models that address emotional adaptation, like culturally grounded grief rituals, identity affirming prompts, or caregiver communication guides. Want to sketch out a framework that for that next. Chronic illness doesn't just affect the person diagnosed, it reshapes the emotional, practical, and relational dynamics of everyone close to them. Here's a deeper look into Here's a deeper look at how it impacts relationships, especially romantic partnerships and caregiving bonds, emotional strain, and role shifts. Partners often become caregivers, which can blur boundaries between intimacy and responsibility. This shift may lead to emotional exhaustion, resentment, or grief over the loss of previous roles. The person with the illness may feel guilt, shame, or fear of being a burden, while their partner may feel helplessness or overwhelmed. Communication can suffer as both parties struggle to express needs, frustrations, or fears without triggering conflict or guilt. Intimacy and connection. Physical symptoms like fatigue, pain, or medication side effects can reduce sexual desire and physical closeness. Emotional withdrawal due to depression, anxiety, or disassociation. Can make it harder to maintain emotional intimacy. Partners may grieve the loss of spontaneity, shared activities, or future plans, especially when illness limits mobility or energy. Identity and autonomy. Chronic illness often leads to identity shifts, both for the person diagnosed and their partner. The ill person may feel they've lost independence or purpose, while the partner may feel their own needs are sidelined. These can create tension if not acknowledged and navigated with empathy and open dialogue. Coping and resilience. Couples who practice honest communication, shared decision making, and mutual support tend to adapt more successfully. Mental health support, like individual or couples counseling, can help both partners process grief, set boundaries, and rebuild connection. If you're designing caregiver toolkits or relationship modules for chronic illness. Okay, guys, so that is B for you. I'll try and do a C in a few minutes. Give me a few for C, please, and I'll try and be back on for that. For now, Gator Wellness, take care, folks.